We've introduced 4 components of caregiver health, wellness, and resilience. Your physical health, your mental health and emotional health, your social and family health, and your financial and career health. But there's one more area we need to highlight if we're really going to talk about making caregivers the healthiest, most well, and most resilient they can be. And that is a look at the caregiving landscape as a whole, or the health of the care situation. It's all the factors and components on this outer wheel, outside the 4 components we've been talking about. It's just plain true that when you know your landscape of caregiving and you're on top of those inputs into that landscape, when the care situation is healthier, you are healthier as a caregiver. You're not as reactive, you're not as burdened, you're not caught off guard, you can manage it much better. Now, we have a course that does a brief introduction to each of these 8 elements, just like this course introduces you to the 4 elements of caregiver health, wellness, and resilience. We actually have a masterclass detailed in planning on each of these 8 components. But for now, as much as it can be helpful, we're going to walk you through a very brief introduction to what these 8 elements are, knowing that if you can understand them just even a little better, to get your arms around them, to not be so reactive, to see ahead of where you are today, this will settle your soul, it will improve your health, and give you a greater sense of control, peace, and resilience. First, caring for your loved one's physical health. This is their physical health, their ability to do the things they want to do every day, their mobility, the way they work with doctors, prescriptions, medicines, and clinics. You'll remember we talked about your physical health, including sleep and exercise, nutrition. Those same principles apply here. How do we keep or think about maintaining as much as we can the physical health of our loved one? Coordinating all of that together is that first component. Next is caring for your loved one's mental and emotional health. This would include their spiritual health. Your loved one faces risks that you face as well, of depression and anxiety, of dementia. This particular element is all about how to manage through that, to find care and support and ideas that keep the mental and emotional health of your loved one strong. The third element in managing that caregiving landscape is the social and family health of the recipient of care. Do you see a pattern? These are the things that we talked about for you already as a caregiver. Isolation is deadly. It increases the risk of decline. So here we talk about how to think through improving and understanding the social and family connections of your loved one, knowing again that if you can improve that piece of their care, it will help them, but also being on top of it will help you. The fourth on this top part of the wheel is honoring your loved one's identity and purpose. Now, this is unique, and it's uniquely important in its strength to the care situation. This is ensuring that your loved one or your recipient of care has an identity and purpose and meaning in their life, that they have a legacy, that they're connected to who they were before they were just receiving care. This helps them draw upon their past or their present and future to find meaning in life, to find their soul's place in the universe, so that they're not swallowed in what things are today. Now we'll move to the bottom 4 factors. The 5th one is monitoring your loved one's finances, legal issues, and insurance. We talked a little bit about this in our previous module on caregiver health and managing your finances. And we said one thing you need to do is understand how to manage the finances of the care situation. So this is that. This is the nitty-gritty of how their estate and their money and their debts and their bills are managed, how care is paid for, how they qualify for programs and benefits, how their assets are protected, how their contracts are signed, and how to coordinate all those moving pieces. The 6th component is their home and transportation. Now, this includes the safety in their home where they live, but it's not just a home. Senior housing and the housing options available to those who receive care are so vast. It might not just be their home of their youth or their adulthood. It might be a new housing situation, or they may have been there for many years. What are the differences in housing options? The costs? Do we need to make a change? What about a move? What are the services available in different levels of care? How do we weigh the risks and benefits? We explore all of that in this category of care, including transportation, which in some cases is their own driving and they're giving up their driving if needed. And if they don't drive themselves, how do they get help going from one place to another, either through public services or through friends and family or through other means? The seventh category here is collaborating with external services and help. There are so many different moving pieces in getting help, from third parties and agencies and devices and technologies and communities to family to your work as a caregiver. This section is all about how to be better in collaborating with those services and to coordinate it together. It's about the caregiver's role connected to the recipient of care's role in moving all the traffic the different places it needs to move. This is a component just about how to architect the care that's coming in and how to stay healthy in that process. And lastly, the eighth component is how to continue this plan, collaborate, and monitor overall. Too often, we put a plan in place for all these components, a plan for the physical health, for the social health, for the housing, for the transportation, for outside services, and then things change, and updates are difficult to manage or to communicate or share or implement. This is an entire component about how to make those plans solid and stable, how to document those, share those, and then keep those plans fresh. Now, as I mentioned, we have additional education and information on all these 8 components, hours and hours worth. But at a high level, they all strongly impact you as a caregiver. And when these areas are better and you feel more equipped to manage them, then you are stronger and healthier. When these are out of control, you feel more out of control. And so we know that your health, wellness, and resilience are tied to these different areas of the caregiving landscape. And knowing how to identify gaps and improvements in these areas will help you become strong and stable yourself. You might already see a need for one or more of these areas to be stronger, and they may be different for every situation. The good news is this: we believe by identifying these 8 categories or buckets that all of the spinning and swirling of issues, the hurricane that can feel like thousands of disparate pieces, they now have a home and a place with some best practices, ideas, resources to organize and improve them. We so very much want to get you the information you need to make you healthier, more well, and more resilient, the very best that you can be. And so this last section is get stronger in the caregiving landscape, and your own health as a caregiver will become stronger along the way.